My name is Jen Arcaro in the Professional Services Department, and welcome to our webinar on this ChartMaker Go mobile app, which is a smart app which can capture charges on your mobile device. So this STI mobile app is used in tandem with your ChartMaker Clinical and Practice Manager. You can install the app on either an iPhone or an Android system. Your patient data is password protected and HIPAA secure. We're going to review today how the app works on your phone and show the billing side that your staff uses on a PC. If you do have questions while we're presenting, simply click on that chat icon and type in your question, and we'll answer those at the end. So the app opens with a HIPAA secure password, or you can now opt to set up your fingerprint to use instead. So this, of course, saves lots of time and memory of what that password was. Each staff has their own login, which is their personal email, and the app does have auditing under each unique user. So you can track what your staff is doing on the app. We are allowed an unlimited number of users for this app. Once STI starts your office's mobile app syncing to Practice Manager, which pulls all of your patient data, you will assign a manager or a super user to set up some preferences and procedure lists, similar to a little charge slip or super bill with your most used procedure codes. All mobile users have access to that list, and as many lists as you need to create, such as the sample ones you see here, a list for testing or vaccines, and they can click on the consults link and get all those CPT codes under that link. Also, each user is able to create their own personal favorites, which is only seen by that user. By marking with a little heart icon, any user can create their own favorite list. And of course, every user can search from the full book of procedure codes. Your home screen, which is on the right there, gives you quick access to each area you may need. And I'll go through those links with you now. And we'll start with that patient link at the top. So when searching existing patients, you'll type in a few letters of your patient's last name, and then you're shown the date of birth and account number of patients that come up with those letters to help you identify the correct chart. While the default option is last name, you can select to search instead by a date of birth or phone number or account number. Then you simply touch the patient you needed to open their mobile page. For adding a brand new patient, this can be done from multiple areas. You simply click the Add New Patient icon, which is circled in yellow at the bottom there. That icon is found in multiple places. It's on the patient link, like we have here. It's on the charge link and on the rounds link. The information that's needed to add a new patient is simply patient name, date of birth, and sex. You can also add a hospital admission date if you need that. And that date, by the way, is helpful for billing later, as any inpatient hospital charges must include that patient admit date, but it's not required from the mobile app. Later, the office staff will be adding insurance and demographic that you provide from a hospital or nursing home face sheet. Practice Manager also has a quick list that your staff can pull at the end of the day to see which patients your providers have newly added to the app to help them with collecting those face sheets. Each patient has a home screen set with easy access for you at the bottom row of your app. The default is patient in teal on this screenshot here. This shows the patient date of birth, home address, 3 phone numbers, your home, cell, and work phone numbers. These are coming from the Practice Manager demographic page. Insurance and details of all normal medical coverage and any no fault or workers' comp coverage will be shown here. You see a quick look at the last and next appointment dates. Pharmacy shows from what your staff has entered in ChartMaker Clinical. This allows you to see all the pharmacy names, address, and a teal link in case you have to call the pharmacy directly. Health proxies are also available. This allows for convenience if a family member maybe is calling the doctor on the patient's behalf. You can quickly confirm that they did indeed sign that proper HIPAA paperwork without having to call into the office to find out if you can speak to that person. The next icon on the bottom row is health. So that little heartbeat icon. This shows what you have on the face sheet of ChartMaker Clinical. So any advanced directives, allergies, meds, and diagnoses. Each can be opened for more details. And when you're entering charges later, you will have access to quickly select those diagnoses if they're appropriate for today's visit. The fourth icon at the bottom, records. If you enter patient office visit notes into ChartMaker Clinical, you will be able to access those from here. The link allows you to open each full note to scroll through the note. It's color-coded by the folders you have set in Clinical, so it makes it easier to find things because you are used to those colors, and you could sort for a specific folder if you needed to for larger charts. Also, this screen shows any electronic lab results that you receive directly into Clinical and allows you to scroll through each of those results. So now it's time to see the charge entry. Patient charges link, which is that $ at the bottom in teal. That same link can be accessed from all 4 of the main screens. Each screen has that same little $ to take you to the patient's history of charges sent from the mobile app. You can click on a list to see the details of each procedure and diagnosis if you're simply looking for details of that past claim and any notes that may have been on that charge. The most used feature is our copy link, those 2 little pieces of paper icon next to each other. That allows you to quickly create a charge for today using the same procedure code and diagnosis codes from a past visit. As that opens for you, you can still edit the procedure code if it's a little different, and you may remove or add from the diagnosis list as well. It is such a time saver to have the system copy the provider, facility, and practice, and while still giving you the ability to tweak the other codes as necessary. And the date can be edited as you're not always entering today's work. The last item on the charge before it is sent from your mobile is a little comments box. So on your cell phone, your keyboard has a mic icon shown in yellow there. This allows you to dictate a note either for the biller or even for your ChartMaker Clinical if you are documenting some outside visits there. Providers sometimes need to add a quick comment for a biller if they can't find a certain diagnosis they wanted or if they have a question about using a modifier. The claim, when it comes up in Practice Manager, contains that note, which is only seen by the biller, is not sent with the actual billing batch. Each time you're finishing entering a charge for a patient, you are taken to this main charge page displayed on that right side of the screen, which tallies up your entries for the day. The provider name at the top can be changed if you need to access another provider. And the purpose of this is to allow you to reconcile your charge entry with the hospital or nursing home list of patients that you had seen today to make sure you didn't miss anyone. On the office practice manager side, your staff is possibly using appointments, marking people as confirmed, rescheduling, collecting copays on the practice manager side. You have access on the mobile app to see any provider schedule, the total patients on each facility, and plus details of the appointment in case notes were written by your staff. From that details page on the right screenshot, you can click the teal links for either chart number to see the full chart of the patient or phone link to call the patient. I've had many an office manager report this is the page they're using on bad weather days. If the office is opening late or even closing entirely, they can call the first earliest patients before they even get to work to reschedule those appointments. The rounds view is where I see facility patients, so either nursing home, hospital, wound care centers, any patient who has an admit date set in the practice manager side. And we can view charge history here, as well as discharge a patient after billing a final visit. And that discharge date goes back into the practice manager side so that billing claims can include that date properly as well. You can get to the full chart from this page. You can mark a patient as skipped if they were unavailable to be seen. And for charge entry, it's very quick to copy the last visit if the codes are similar to today, or create a new visit completely from scratch. Back in your practice manager, this is where the office staff can pull a list to check which brand new patients your provider has entered on the mobile, who of course will need full demographics and insurance and hospital information to be entered in order for those claims to go out. And under Practice Manager Charge tab, any charges that you send from the mobile app, the biller will review and approve each line item here under the Pending Charges subtab. Any notes that you dictated into the charge itself will also be able to be seen here and saved with the claim, or they could remove the note. There is a new feature on this screen where they can process an entire counter, multiple CPT codes at once as well, because there's enough information on this screen here to check that the provider added a modifier that's needed as well. Okay. We have installed over 3,000 practices since 1979. So our ChartMaker mobile app is the newest part of our STI kind of program family. We can allow more flexibility for where and when you enter your patient's visits. And this, again, can be installed on an iPhone or an Android cell phone. This concludes our presentation today, and we can unmute everyone now. Let me know if you have questions, or Chris, if there's any in the chat, we should look there.
Jen, yes, there is a question. Can you make an appointment for a patient that's in the hospital?
Okay. At this time, we cannot make any appointments. We are just looking at the appointments that are already in your practice manager. What you can do, though, is if somebody's in the hospital and they're not in your program yet because they're new to you, you can add a brand new patient into the system. So I have seen those staff who use appointment lists and they create a hospital column so that they can, after the fact, put their hospital patients in a list of practice manager appointments. That way they can run that appointment reconciliation report that practice manager has. So it does help if you don't have, 80 patients in the hospital. That's an option, but it's your office staff who would be putting it into the appointment screen.
Jen, I don't see any other questions or comments here. Maybe we'll just give it a minute and see if
Yeah,
anyone
anybody
submits
have
another chat.
Question?
As I said in the beginning, we will put the recording of this on our website so you would have access. Or if you would want somebody from your practice, maybe the physicians or your billing personnel to take a look at it, it will be there. Usually takes us maybe 24 to 48 hours to get it up there.
I added a chat question. I added one.
Go ahead.
This would really help with billing if we could get the, if you could make the post-hospital, even if it was like a temporary one, you know, when you can go into other programs, they let you make an appointment, but really it's not firmed up till the office staff actually firm it up, because that would really help with capturing that 7 and 10 day TCMs. I guess the doctor could probably put it in the note, arrange follow-up, patient discharged, arrange follow-up in 7 days. Or
Oh,
10 days.
yes, that would be a good thing to put in that little comment.
Yeah, because you're missing, that's a big number. You know, the 99495s and the 99496s are huge revenue makers.
That you always try to follow up with a dismissed hospital patient 7 to 10 days later.
Yeah, I actually have a program that does it for on the dialysis side, because they're a nephrology group. So on the nephrology side, I have a software that I use that, that's already built into their rounding. But on the hospital side, you don't have that. You know what I mean? You can't really get in there and say, oh, wow, this patient, I'm discharging this patient today, or maybe not even discharging them, because obviously if you're a specialist, you're not. But
right, you're not the one to discharge, yeah.
You're not going to provide any more care. You're taking them off. You're not going to see them again. And then this way, if they wrote a note, then the office could capture that 994, get them in there as quick as they can. 7 day, I forget, 7 days, like $248 or something for Medicare.
Really?
Yeah, it might be closer to 300. I might be wrong. And like 185 for the 14 days. So it would behoove you to try to figure out a way to make it, to get this thing to make a temporary appointment. Not a real firmed appointment, just kind of putting it in there so the staff get it and say, oh, yeah, let's, or put a note. Actually put a note. So when you guys are doing another demo, you might want to mention that that's an ideal place for them to
to add that comment.
Yeah, to put those codes. Yeah, 7 day follow-up, please. 14 day follow-up, please. That kind of thing.
Okay, Jen, we have another question. I think you did answer this. How many users do we have so far? And she says, can we set it up today?
Not that quick.
I know, right? It does take us a couple days. We'll have to schedule someone. And then the database itself usually takes a full day to copy all, let's say you have 12,000 patients. That does take some time. So I've seen even a really large practice, it took us almost 3 days to copy all that information to the mobile side. That's a one-time just copy.
What's the fees, Jen? There's got to be fees involved. Right
now, we don't have a fee. It is still technically in its beta. So we don't, I'm not sure, Eileen, do we have like 30 offices? Maybe it's a little more using the app. So at the moment, we don't have a fee for this.
So if somebody originally started using it, not this version, but you guys still had a mobile app before this. You just made it better. Right.
Yeah, it's been maybe 3 years that we've had.
So
Yeah,
that would be if someone already had it, like one of my doctors already has it, uses it, so that would be a simple case of just upgrading it somehow, right?
His phone or her phone would have simply just upgraded it. The app itself just kind of upgrades like any other app.
And you said the training will, this WebEx will be available, right, for them to look at soon?
Yes. Yeah, that should be up there. We also have another, we have lots of documentation. When you do get set up, they send you 2 different videos that we have already, and also paperwork. So there's a lot of instructions and a cheat sheet we have for using the system.
And I'm assuming you can arrange training on a one-to-one on if you want
Yes,
to and pay for it.
right. If
Okay.
you did want to, right, some billable personal
Uh,
training.
Well, that's what
But
I'm saying. I think the doctors will figure it out rather quickly, but the billing people may not figure it out as quickly.
right.
Yeah.
Oh, actually, it's not, yeah, it's not too bad once they, so that wouldn't need more than 10 minutes of training, the billing part of it, because everything's sitting there waiting. In fact, if they don't notice that a charge is waiting, if they open the patient on the charge screen to try to enter one from scratch, there's an automatic pop-up that says you have a pending charge.
Oh, that's neat.
So then
That's
they
great.
could go
Yeah.
quick look at it, make sure it's the same date of service so that they don't inadvertently duplicate bill.
And technically, I mean, your idea about, during the pandemic, of course, but even during major snowstorms and people weren't blocked, can't get in the office, they could actually do some work. But this could be used in an office setting. I don't know why you'd want to look at a little screen, but it could be used,
Right.
correct?
Yeah, I've only seen a doctor use this in the office because there was not an extra laptop for her.
Yeah.
So she just wanted to quickly get the charge in and just liked her cell. So that worked out. And it didn't need a clinical note. So she was only
Yes, but
entering charges.
I could see this being used very easily for chronic care management and even for telephone calls. The telephone billable
Oh,
calls.
absolutely, for the telemedicine calls.
Yeah,
Yeah.
well,
Need
the
a quick
not
note.
necessarily the video one, but obviously the telephone one or chronic care management if you're tracking and billing home care or CCM.
Yes. Yeah, we have podiatry going home visits. That seems to be very convenient too.
Well, I meant non-face-to-face. There are so many non-face-to-face related codes that are billable now. You know what I mean? And the tracking part always becomes a little bit of a nightmare because you have to get staff to put the time in as they're
Right.
talking to people.
Right. This
So.
is true. This is true.
All right. Well, thank you very much for attending this morning. Have a great day, everyone. And we will have this up on our website shortly.
Okay, great. Thanks, Chris.
Thank you.
Thanks, Fran.
Have a good day.